Good afternoon. Apologies, we're just running a couple of minutes late with a few technical problems, but welcome again. As you will all know, we've obviously reached a major milestone this week with 0 known active cases, and as Nikki will tell you, today is the 29th consecutive day of no new cases. By special request from some of you, I'm wearing a rainbow tie in celebration. And as further good news, at its meeting yesterday, the Civil Contingencies Authority was able to lift some of the regulations which are no longer needed, such as those relating to the temporary provisions for driving licences, pharmacies, or the registration of medical professionals. We will now keep the remaining regulations under regular review every 2 weeks. But, and there is a but, the main provisions do remain because lockdown is not over. Lockdown has changed and it's clearly got easier, and but categorically lockdown is not over, and we cannot be complacent. We've all said this several times, many times before, and we will say it again and again. The number of reported cases is continuing to climb globally, and although Europe is starting to exit lockdown, as we know, and that I think would make it very easy for us to think that the crisis has passed, but it simply has not. Many, including the UK, are exiting, not least because everybody knows it's simply not possible to retain the highest level of lockdown indefinitely. And remember that the number of new cases in England alone, so excluding the other nations in the United Kingdom, in England alone is running at 52,000 a week. So that would be the equivalent of about 60 a week here. And if we were running at that level, Nikki, I'm sure there's not a cat and hell's chance that we would be close to phase 4 starting tomorrow. And that's why we are strengthening our borders with non-essential travel now permitted. It is absolutely critical that the compulsory period of 14 days self-isolation is strictly adhered to. And Rory Hardy, the head of law enforcement, is going to talk in a little more depth. But there are 3 changes with immediate effect. The Civil Contingencies Authority yesterday agreed, firstly, that a breach of the self-isolation requirement will be an arrestable offence, and Rory can explain the significance of what that means. Secondly, we agreed that the maximum penalty for a breach would be increased from £1,000 to £10,000. And thirdly, we agreed that an employer or contractor will now also be liable for an offence as well as the individual who breaches self-isolation. And finally, we've also increased the resources in the team supporting those in quarantine, and that team will be increasing contact with those in self-isolation, including random home visits and spot checks. And again, Rory can speak a little bit more about that. So we have to be very, very clear that until the UK has got a firm grip on COVID-19, and frankly it has got some way to go yet, the borders are our best defence against new cases in the bailiwick. And we intend to ensure that they are as strong as they need to be for as long as they need to be until the risks of increased inbound travel can be properly mitigated and managed. And so to phase 4. Deputy Salisbury and Dr. Brink will take you through some of the guidance in a moment. And as we've said about guidance before, it won't be perfect first time. We will continue to flex and respond to the experience and the feedback we have. There are still requirements in phase 4, particularly in relation to social distancing and the size of gatherings. And of course the police will be taking appropriate enforcement action if needed. I mean, let's hope that it's not, but they will also be conducting more foot patrols, particularly on popular beaches such as Cobo, to remind people of the importance of following these vital public health rules for the benefit of the whole community. I really don't believe, I personally don't believe that this will happen, but if the Guernsey Together spirit did break down and everyone just chose to do their own thing, ignoring the rules, we will almost certainly see more cases and more importantly, more cases that cannot be properly traced and managed. And if that happens, we will go backwards. So be in absolutely no doubt, the Civil Contingencies Authority will have no hesitation whatsoever in locking down if that is what is needed. And I think we have already demonstrated our willingness to take decisive action when we deem it necessary. So let's please all continue to work together to make sure that that does not need to happen, and also continue with the great community spirit of cooperation and courtesy that has marked really has marked, I think, this period in our community's life. So in supermarkets, let's continue to give each other space as we reach for that tin on the shelf, and respect those essential workers who have kept us going through the very toughest days of this period. There's just a couple of other brief things from me. Firstly, with schools starting back, please consider your active travel options, such as walking or cycling, particularly during this fantastic weather we're having. The school buses will be operating, but social distancing is self-evidently difficult. And if everyone chooses to drive, of course, not only will the roads be busier, but it will also become much harder to maintain social distance at drop-off and pick-up points as well. And secondly, some other changes in town to help pedestrians more easily maintain a good 2-metre uncontrolled social distance, and Heidi and Nikki will explain what that means in a moment. Whilst walking around town, it is necessary to close Church Square and the Lower Pollet effective tomorrow, and also to help the hospitality trade with alfresco seating during this fantastic summer weather. In a pilot this weekend, the quay will be closed from 10 a.m. Tomorrow, and consideration is also going to be given to doing this in the evenings as well, and further information will follow on that in due course. So that's enough from me. Heidi.
Thanks, Gavin. Well, we've had no new cases for 29 days and no known active cases in the bailiwick anymore. So as such, we will be moving into phase 4 as of tomorrow. Now, last week I gave an overview of what phase 4 might look like. Since then, we've had requests for more information and ideas about what we should do and what we shouldn't. I really would like to thank everyone who has contacted us, as this input has helped shape our understanding. We've always said that our approach has been to do what we believe makes sense for our community. Listening to you means that we can walk the walk and not just talk the talk. So along with Nikki, resuming our double act, I'll now give an overview of what phase 4 will mean, add meat on the bones of what I said last week, and try to answer some of the questions that have been asked since then. So, now, a lot of work has gone on since we last met, ensuring that what we ask of you is both appropriate and proportionate to the situation we find ourselves in. Whilst the news is absolutely fantastic, it is only through lifting the restrictions in the way we are doing will we have any idea whether there are any cases still out there. If there are, and we don't maintain key controls such as social distancing and hygiene guidance, we may find ourselves in a difficult position again. At the same time, we appreciate that if certain businesses are to be able to open and activities take place, compromises may need to be made. It's all about taking a risk-based approach. But remember, work from home if you can, and stay at home if you're sick, even if your symptoms are mild. Throughout this, we've listened to Dr. Brink and her team, understanding what is an acceptable risk and what isn't, and from that worked out how we could get the balance right. As I've said before, there is no right or wrong answer, but hopefully that is what we have achieved. Key to our approach is being able to retain the ability to test, trace, and isolate. Now, before moving on to the next slide, I'd just like to talk about travel, care homes, and the hospital. I stated last week that non-essential travel will be permitted subject to anyone returning being required to self-isolate for 2 weeks. Some are concerned this will open the floodgates and that people won't follow the rules. And others have been asking, why do we have to isolate for 2 weeks when we come back and yet specialist contractors don't have to? Well, Gavin has already spoken about the changes we're making in respect of offences, and the Head of Law Enforcement will speak shortly about what his team will be doing regarding ensuring people follow what is a legal requirement to self-isolate. With respect to specialist contractors, the Committee for Health and Social Care discussed this at length earlier this week and don't believe that the proposals presented to it are sufficiently robust to enable it to permit special arrangements for such workers at this stage. We'll be happy to review this, but would like to obtain further information, including seeking advice from colleagues, including those on the COVID-19 Recovery Advisory Group, which we'll do in the next week or two. Now, Nikki, you want to talk about your announcement today?
Yes, so one of the things we have changed is the travel and the allowance for non-essential travel to occur with the 2 weeks quarantine period. And I think it's really important, as we change these guidance, we will see increasing numbers of individuals travelling. Now, I think it's no secret that I've had very neutral views about the use of masks in the community for individuals who are not ill. However, I've always said that in a confined space, for example, in public transport, there may well be a role if the public transport is fully utilised. So as we change our guidance for travel, and we allow non-essential travel subject to quarantine, we will inevitably see more people on our planes. To date, our planes have been fairly empty. So we're talking about travel from outside of the bailiwick into the bailiwick. We're not talking about travel around Guernsey per se. So what we're going to be doing from next week is people who are travelling from Southampton to Guernsey and vice versa, and I'll talk about going on to Alderney in a moment, will be requested to wear a face mask, which will be given to them as they go through the security check. They'll be requested to wear that face mask until they reach their destination. Now, the reason for doing it, if a person becomes sick while they're travelling, that face mask will prevent or help protect some infectious respiratory secretions being transmitted to other individuals. This is specifically related to when you have a confined area with no natural ventilation, so exactly the situation that you'd have on an aeroplane. So it's very specific advice for a very specific set of circumstances. So I think that's important. What we've always tried to do is use the evidence and also use the evidence when it's applicable to us. Now, we've also tried to act early before we're faced with a situation where we feel we have to act. So we're anticipating our planes getting more crowded, and for that reason, what we're asking people to do is wear a mask from going through security until their destination. Now, with regard to Alderney, we're going to be asking people to wear masks on the Dorniers as well. The reason why, although some of that might just be intra-bailiwick travel, so people travelling from Guernsey on to Alderney, some of those people will have travelled on from Southampton and then on into Alderney. So it's really just to try and make it practical for us to administer it. So it's a change, but it's a change based on evidence that we have in relation to people in confined areas that have no natural ventilation. So I think that's important that people understand the reason for this change and why we're introducing it at this stage. So I'm going to hand back to you, Heidi.
Thanks, Nikki. Before we move on to the next slide, I thought I'd just cover off care homes and the hospital. Visitors will be allowed into the care homes from tomorrow, although just one per resident at the moment for up to an hour a day, and they must be the same visitor for every visit. There are specific rules over social distancing and being able to take residents out, and each home will manage their visits, communication with families, and maintain an accurate log of visitors, contact numbers, and each visitor will have their temperature taken before the visit. Visits are now permitted to the hospital, although again just for one person per patient, and various conditions apply. There will be less use of PPE, more theatre activity, outpatient appointments, and imaging services. Birthing partners may now attend caesarean sections, and ultrasound scans and screening programmes are now restarting. So, moving on. Now I'd like to turn to social distancing. There's been a lot of discussion over this. Do we still need to bother? Well, yes, we do. As I've already said, this will be crucial if we're to continue to control any potential spread of infection. So while social distancing of 2 metres should be maintained where possible, it's recognised that this isn't always achievable, and reduced social distancing is okay in certain circumstances. However, What will be absolutely essential is that we can test, trace and isolate. Contact tracing will be critical, especially as lockdown measures are eased and more people will be out and about. Now, one way people can help with this is by keeping a diary of where you've been and who you've been in contact with. Template diaries for both adults and children have been produced by our comms team, which can be downloaded from the coronavirus webpage. But of course, you can do your own, and children might like to design their own. So, in addition, as a means of enabling further easing of restrictions, but also not compromising our ability to control any future spread of infection, we're also introducing the concept of controlled and uncontrolled environments. Controlled environments include places such as restaurants, cafes, pubs, clubs, groups, and non-contact sports teams, where a record of attendance is able to be kept and other strict measures observed, and we'll speak more on that in a moment. In uncontrolled environments, like supermarkets, other retail outlets, shops, parks, and playgrounds, a 2-metre distance will be necessary from people you don't know. This is because it will be hard to record who has been in contact with whom. Also, if a gym or sports facility can't keep a record of attendance with details of timings and use of gym equipment, then a 2-metre social distance should be maintained. Nikki, did you want to?
Yeah, so basically the differentiation between the controlled and uncontrolled environments is important. So if you look at the Public Health England recommendations, they'll say to you 2 metres. If you look at the World Health Organisation recommendations, they'll say 1 metre. So there are various things. Australia is thinking of using 1.5 metres. So there are various parameters that are being used. We looked at all of these parameters, but the one that's been used in New Zealand, which we found very attractive, was they differentiated between where the environment was controlled. Now, controlled reflects our ability to contact trace. So if you have an event where you've recorded everyone there, so the restaurant knows exactly who was sitting on what table on what date, for us to then go and contact trace, it's very easy. And I think it's important with contact tracing is we'd aim to start contact tracing within an hour of getting a positive result. And that's really important. So if we got a positive result, and hopefully not, but if we got a positive result at 7 o'clock tonight, the contact tracing team are available 24/7. They would be in by 8 o'clock to start their contact tracing. So with a controlled environment, we don't want to spend 24, 48 hours trying to get that list of individuals. So it's important to be effective that we start that contact tracing straight away. So because we're able to test, track and trace very, very effectively within a controlled environment, we feel that a 1 metre distance is reasonable. And this also enables some of our businesses to start functioning. So really it's looking at the whole island's approach. Where we are less able to contact trace efficiently is where you have an environment where people might have been walking around together in a park, walking around together in a supermarket and so on. You're less able to contact trace as efficiently. So I think that's really important. So differentiating between the controlled and uncontrolled environment allows us some flexibility in the distancing between people, and also allows us some flexibility in how our island can become operational again. Thank you.
Thanks, Nikki. Go to the next slide. So, as Nikki's just given away.
Oh, sorry.
No, that's not true. In restaurants, cafes and pubs, there needs to be at least 1 metre between tables, and table service only is permitted. People aren't allowed to stand at bars or order in a way in which they mingle with other tables or patrons. Strict controls also need to be placed on the number of people using restrooms dependent on their size, and they must be regularly cleaned. Hand sanitizer must be readily available to patrons, and hygiene measures observed. Did you want to talk any more about that aspect, Nikki?
No, I think it's mainly just it's the hygienic principles, it's the table service, it's the 1 metre distancing, and it's having the list of individuals, and I think that's really important.
Okay, one thing I will just add on to all this, we've decided that the pubs not serving food can open in phase 4, so long as they can follow the new guidance. However, having taken law enforcement advice, they won't be able to do so until Monday, the 1st of June. When they do, there will need to be controls over entry to ensure that social distancing can be maintained. On to the next slide. So for hairdressers, beauticians and other businesses where physical contact is required, In all cases, single-use equipment should be used as much as possible. Any items that require laundry must be washed at the highest temperature that the fabric can tolerate, ideally at least 60 degrees C on a long cycle, and if possible, tumble-dried and ironed. Equipment to be reused, such as scissors and beauty tools, must be sterilised between clients. And where a station is being used by more than one client at a time, for example, during staggered hair and beauty appointments, any contact surfaces should be wiped with an appropriate cleaning solution between users.
Yeah, and I think the only other thing about things like hairdressers who obviously will have direct contact, what we're saying to them is just think about how you practice. So, for example, you can cut someone's hair, but during the consultation is take a step back and have that social distance. And a lot of those hairdressers and beauticians have come up with such suggestions themselves. So it's using our common sense about having direct contact where you need to have direct contact, but then stepping back when you don't need to have that direct contact.
Okay. So now, as I said last week, we're not requiring registrations in phase 4, but due to data protection issues and the need for public health to be able to contact someone at short notice, those operating a controlled environment will need to email their details to this email address. Apologies for the length of it, controllbusinessnotification@gov.gg. I've been assured that in the guidance, people only need to click on the document, so they don't have to type all that out. But anyway, that is the email address for people to use. Slide 8. Okay. Now, we've had questions as to what phase 4 means with respect to socialising and gatherings. As I said last week, gatherings of up to 30 people will be allowed subject to social distancing and hygiene measures. I know there's been some confusion about this following the announcement, for which I apologise. As I've said previously, we don't always get everything right first time. Further work over this last week means we can now provide some more clarity. So for tomorrow, you can arrange a social gathering of family and friends inside or outside of your home. For those people who you chose to bubble with in phase 3, nothing needs to change in terms of the close contact you can have with those family and friends. What we would ask you to consider is that you're aware of your personal space and hygiene arrangements when extending your contacts to up to 30 people. It's also important to point out that any gatherings above 30 will be a breach of the law, unless it is for a wedding ceremony or funeral, where a maximum of 50 are permitted. But please note that only a maximum of 30 is permitted for receptions and wakes, just like any other social gathering. Nikki, would you like to give a bit more on behind that?
Yeah, so with regard to the numbers, we looked at a lot of data. So if you look at some countries, they'll say 100, other countries will say 10. So there's a huge variation. So we came back to first principles again, and we said, well, what is our concern about gatherings? Our concern is that we have a case and that we are able to contact trace and we're able to contain it. So with a gathering of up to 30, we're fairly confident from a public health point of view that we'll be able to, if we had a case in that, we'll be able to effectively contain and contact trace it. So it's looking at what we've got a capacity to respond to. So it was really, that's why we didn't go for the very restrictive 10, nor did we feel that 100 was a good idea at this stage, bearing in mind how quickly we're coming out of lockdown. And we thought 30 was reasonable and was a number that we felt confident that we'll be able to respond to from a public health perspective.
And it's right that the 50 for weddings and funerals, it's because it's a more controlled environment, even more controlled environment, and you're able to give more tolerance for those conditions.
Yes, and we could then, in a wedding, for example, we could ask people to sit socially distanced, same as for a funeral, so it would be, again, easier because people were socially distanced to contact trace that.
Thank you. So crucial to enabling this to happen again is being able to contact trace, as Nikki has said. So if you're organising a social event or gathering up to 30 people, we need you to do the following to help Dr. Brink and her team. Keep a list of the people who attended the social event or gathering. We need their names and a contact telephone number. Maximise social distancing where you can, and we know that it won't be possible all of the time. If you are providing food, you need to consider the following. Do not share plates or utensils. Wash utensils in a dishwasher if possible. Don't provide serving spoons. Individuals should serve food with their own cutlery. And reinforce hand hygiene and cleaning regimes. Don't let people attend if they're unwell. Make sure that toilets and other hygiene facilities are cleaned regularly. and where possible, toilets should be used by one person at a time. And I think that meant cubicles, not just...
Unless it's a child.
I know, just reading that just sounded strange, but yeah, I think that we know what we mean. And reinforce hand hygiene with all of those who are present at the event or gathering. So, the effect of the changes we're making is quite profound. Virtually all businesses will be permitted to open, and virtually all recreational activity can resume with no time limits. That means social distancing and hygiene become increasingly important. As we extend our social contacts beyond our bubbles, people will need to take personal responsibility for the actions they take. We know that your contacts with close family and friends will be different to those who are slightly further removed. We're not asking grandparents to avoid cuddling their grandchildren if they weren't included in their bubble in phase 3. We're not asking people to sit 2 metres apart from each other in their own homes when having dinner. We're not asking you to lock yourself in your house and avoid all human contact. What we are asking is to recognise the risks and maximise social distancing where you can. Where you can't, then other public health measures should be increased, such as hand washing and cleaning regimes.
Yes. So just to finally say, we're day 29 with no new cases, so again, really positive. We want to heed the message of not to be complacent. We're moving out of lockdown, we're doing really well, and we want to try and keep where we are, keep progressing forward, and I think that's really important. The expanded testing system has been introduced early because we've got so few symptomatic cases now. So we're testing all of primary care, or people in primary care this week. We're moving on to some other areas in the hospital, to radiology, intensive care and theatres over the weekend, and into next week we're starting the community staff. So we're progressing really quickly with that programme, and we're also going to be offering testing to sectors such as the airline pilots and cabin crew as well. So we've got the capacity to move forward with testing in these sectors. So really positive from our point of view, but we mustn't be complacent. We must be aware that we've done well, but we must hold on to the ground we've gained. So thank you.
Thank you. So finally, don't forget, if you have symptoms, seek medical advice, get tested and stay at home. Maintain social distancing as far as possible and follow hygiene guidance through washing your hands, respiratory etiquette, like catch it, kill it, bin it, remembering, as I was told as a kid, sniffs and sneezes spread diseases. And finally, now we're approaching the new normal, and as our economy is opening up, support our local businesses, many of whom have had a very difficult time over the last 2 months. Keep the Guernsey pound in Guernsey.
Excellent. Thank you very much. Heidi. So, Paul.
Of course, on that note, one of the most positive parts of moving to phase 4 is that it allows so many more businesses to reopen. Businesses who have had to close since the very beginning of lockdown. This has been incredibly hard for them, and indeed you as their customers. It's fantastic they can now reopen, so much sooner than expected, but it's essential that they continue to observe the guidance issued. Much of this last week has been supporting the political decision-making process and carrying that out through designing and working on updated guidance for all businesses. And a great deal of that material was issued last night. We have done everything we could to make the information as clear and as flexible. However, it may not be perfect, as said. We are still experiencing and learning together. Certain areas that needed specific detail that was taken time to produce. More guidance will be issued over the course of the coming days. But if your business isn't covered, then please read the general information, apply the hygiene rules, and in the meantime, that we ask that all customers remain patient. And the understanding as businesses work out how to reopen their doors safely and begin trading again. All information is available on our website, including requirements for social distancing in controlled and uncontrolled environments that have already covered off today by Deputy Salisbury and Dr. Brink. But it goes further than that, and it looks at a wide range of business activity. All businesses need to make sure they have read and understood what is required in phase 4, whether they've been open in earlier phases or not. That includes, importantly, how to notify that you operate in a controlled environment and what records you need to keep. Environmental health will continue to monitor to ensure businesses are meeting those requirements and following the guidance, and will maintain frequency of spot checks. Our phone lines remain open for questions if you are unsure or have further questions. 20.5 million in support to business has now been paid out. A total of 2,356 businesses and self-employed people have received payments in the form of either a grant or payroll support, or indeed in some cases both. Around 7,000 employees are being supported by the payroll support scheme. We have a very small number of outstanding cases and expect those to be processed imminently, and thank you for your patience if you haven't yet received that support. Our business support schemes will continue until the 30th of June to support those businesses who remain eligible. We are continuously assessing the requirements of support measures and will continue to assess potential needs beyond the 30th of June. Some specific parts of the economy will undoubtedly remain affected and may need further support. The impact of this pandemic on our community will be felt for some time. Whilst there are signs that unemployment claims are reducing, businesses may well have adapted, and some may take these changes into their recovery plans. This may have an impact on our employment figures, and it's important that we're cognizant that this, especially as we build upon our island's recovery strategy, expected to be debated in the States in mid-June. The same will be true of the public sector, and like businesses across the bailiwick, we are looking at what Phase 4 means for us and how we operate and how accessible our services are. We ask that you are patient with us also, as it will not be possible to open as we were before lockdown. The reason for optimism: we are working on our recovery and what opportunities there are to be taken from the situation in our bailiwick. What has been the common thread to get us to this point has been our willingness for all parts of the community to work together, and this will be absolutely key to our success moving forward. It is our commitment to you that we will continue to engage with you in an open and transparent manner as we shape the recovery, just as we have done so far.
Okay, thank you very much, Paul. Rory.
Thank you, Chief Minister. Obviously, it's great to sit here and hear the successes that we've made. But Bailiwick Law Enforcement, we do have some important announcements that we need to make, and these are here to keep the bailiwick safe and to reassure you, the public, that we are working in your interests. Our previous terms of engagement have very much been to engage, to explain and encourage members of the public to do what you've asked to do, the hand washing, the social distancing, and the last resort for us has been enforcement. However, with respect to individuals travelling into the bailiwick who would require to undertake the 14-day isolation, we are now focusing on two elements. One, in conjunction with public health, looking after the welfare of those individuals, because we do accept to go into 14 days of self-isolation has quite a few challenges. However, the enforcement of that isolation is now becoming a priority. Any new arrivals, whether by a boat or plane into the bailiwick, will be met by Guernsey Border Agency staff. Individuals will be given a very clear direction as to what the expectation is of the 14-day isolation. These briefings will be video recorded, and there will be absolutely no question for individuals as what is expected of them. Once the individual has left the port of entry, a team charged with enforcement of the isolation period and also looking after their own physical requirements, like inquiring about their health, will be taking up contact with those individuals. There is a significant amount of public trust placed in an individual who travels in, and they have to comply. However, if we receive information or intelligence that indicates that the 14-day isolation notice is being breached, law enforcement, in conjunction with public health, will take steps to identify any breaches. There will be a zero tolerance taken, and the Civil Contingencies Authority have made a number of have increased a number of powers available to us, as alluded to earlier in the press conference. Firstly, an employer is responsible for bringing in staff into the island. They also have a responsibility to ensure that the 14-day isolation notice is complied with. It will now be an offence for an employer to encourage or assist a member of staff to breach the 14-day isolation. In addition, It is now an arrestable offence. So I apologise, from 1 minute past midnight tomorrow, it is an arrestable offence to breach the 14-day isolation notice. The power of arrest is discretionary, and it will be up to the individual law enforcement officer as to whether or not that power of arrest will be used. But this is there to provide the public reassurance that law enforcement have the powers we need to keep our community safe. The importance of keeping the island free of the COVID virus cannot be underestimated, and this, I hope, will be a reassurance. Currently, there are 234 people in the island subject to 14-day isolation notices. Within the last 24 hours, we've had contact with at least 100 of those individuals, and there have been at least 16 home visits to ensure that compliance is being maintained. In Alderney, we have 5 people who are subject of isolation, and the same procedures have been followed by law enforcement staff in Alderney. SARC currently don't have any such cases, but we are supporting SARC authorities as and when necessary. With regard to the general law enforcement activities, we've been working hard in preparation for Phase 4. Tomorrow we anticipate the island will have a significant change in social behaviour, but we would ask people at all times to maintain social distancing and respect those around them, including neighbours if you're planning gatherings and parties. Parents, we would ask you to make sure you know where your children and your young people are. Our young have played a massive part in the response that this community has put into preventing any further spread, but we need to continue to protect our young people, particularly as alcohol may feature. Road safety and pedestrians. Potentially there'll be more people out tomorrow evening enjoying some of the extended freedoms. If you're on the roads, please take care. There are likely to be more pedestrians out there. If you're a pedestrian, please make sure you've got bright, high visibility clothing, because not all our roads are lit and it does raise some dangers for pedestrians. Tomorrow evening, there will be additional police officers on duty to ensure that we can cope with any increase in demand. Over the last few days and this evening, our civil protection volunteers have been working with us to keep a close eye on beaches and public places and to ensure that social distancing is being maintained. Please, can you continue to respect the need for social distancing? And as we move into Phase 4, the licensing trade comes out of lockdown, and in the coming days and weeks, law enforcement will be working closely with licensees and hospitality businesses to ensure not only compliance can be maintained, but there's good cooperation between those managing licensed premises and law enforcement. Our visibility concerning roads policing is relatively constant, and we're beginning once again to start keeping an eye on parking. Fixed penalty notices and parking enforcement will come back into force as of tomorrow, Saturday the 30th of May. This is due to the island becoming substantially busier and people slowly returning to businesses and workplaces. In addition, we know that retail premises require parking for customers, and people using our businesses need access to parking. Once again, from a law enforcement perspective, we'd really like to thank the public for their continuing cooperation and assistance, and we're very, very grateful. We will continue to ensure that the bailiwick remains safe and secure. Thank you.
Great, thank you very much. There's obviously been a lot of information communicated in that first session, so we've taken up quite a lot of time. So I think we'll allow up to half an hour of questions. We'll run to 2:15 if needed. So who'd like to kick off with the first question? Yes, one.
Yeah, William Green, Guernsey Press. Thank you for the update. Obviously, businesses and islanders appreciate this is a fast-moving situation. I think they'd also appreciate some clarity about when it comes to planning travel. Are summer holidays a write-off this year in favour of staycations? Is it likely that those restrictions will remain in place until September, for example? And in terms of masks, will they be compulsory? If you don't wear them, will you be refused travel or face a penalty? And similarly, will police be wearing masks when they do home visits as well to check on those people. So those are the main questions, I think, from me so far.
Yes, I'll kick off with some of the, attempt to answer some of that. I mean, I think the general thrust of whether people will be able to travel away, particularly for some holidays this year, I think it's very hard to give a definitive response to that at this stage. As you said, Will, it is a fast-moving scene. I think the additional issue of the UK introducing its own quarantine regime from the 8th of June, and still I don't think we've got complete clarity on the matter of those in transit. So if you go into the UK and then fly off to wherever for your summer holiday and then come back and need to transit across the UK to get back to Southampton or whatever, there may well be a requirement to self-isolate in the UK. So there's still quite a lot of uncertainty. I think the lack of travel capacity anyway is going to severely restrict plans. So I think, I mean, my advice would be, certainly if people haven't made plans, I wouldn't be making plans personally. If people have made plans, I think they're just going to have to keep the matter under review until closer to the time, and then make a decision based on what's going on at that time in, I guess in probably 6 or 8 weeks' time when we're in the main holiday season. In relation to the sort of the more detail, Nikki, do you want to pick up some of that?
With regard to masks, it's quite clear. So first of all, no, we've got no plans to make it compulsory. We're strongly encouraging people. Specifically related to masks, we're interested in the travel in and out of the bailiwick, because that's a risk. As far as we haven't had any cases any new cases for the last 29 days. So it's that travel from outside in and out of the bailiwick that we're particularly interested. The second thing that's of critical importance, you're in a confined space with no natural ventilation. So those are the specific risk factors we're looking at. We're looking at travel in and out of an area, in other words, the UK, that has ongoing community transmission of the virus that causes COVID-19. And the second thing is you're concentrating people in an area with no natural ventilation. Now, prior to us widening the ability for people to travel, there were far fewer people on the aeroplanes. What we are anticipating is that there are going to be more people on the aeroplanes, and I think most of you know how I like to be prepared, so it's actually kind of looking forward, not necessarily to where we are now, but where we might be in 2 weeks' time, and that's really what's important. So it's a confined space and the travel from outside the bailiwick, which are the two critical points in the decision making, and the third being the anticipated increase in travel that may occur, with us saying that you can have non-essential travel subject to the 14-day isolation when you get back here.
Okay, next question. Yes.
Just, sorry, Keelan Webster, ITV News. Just on the new rules regarding self-isolation, is it up to £10,000 the fine, or is it just a straight £10,000 fine now if you do break the rules?
It's a maximum of 10,000. So ultimately, it would remain a matter for the courts, and based obviously on the evidence that's presented by from law enforcement. Next question. Yes, Ewan.
Ewan Duncan from BBC Guernsey. I wonder if you could just explain to us what the new regulations are in terms of going to a restaurant and going to a pub, and the opening times, and why Public Health have decided on those guidelines.
So what we've tried to do is not select a specific sector and saying, well, that sector can open, that sector can't. What we've tried to do is set some public health guidelines, because if you go back to your first principles, we're trying to prevent transmission of a virus, and that doesn't matter what area you're in as long as you set your guidance. So with regard to a place where you can either eat, drink or both, is we're looking at tables being at least 1 metre apart. We're looking at seated service only, so table service only, so you don't have congregation of people either at a counter or at a bar. We're looking at access to hand hygiene and toilet facilities that are cleaned regularly, that have one in, one out, aren't overcrowded, and so on. And then we're looking at the ability of that area, of that facility, to actually keep a list of exactly who was there and where they sat. Because that's really important. Because as I said, if we get a result, a positive result, we want to be contact tracing within an hour of getting that positive result. And so it's going back to those first principles, rather than putting a value judgment of one sector versus the other sector, saying these are the principles from a public health point of view that we think people would be able to function with a sufficient degree of safety. We're never going to say something's entirely safe, but we think that's a sufficient degree of safety to keep the bailiwick in the good position we're in. So we looked at various sectors and we decided that wasn't a pure way of making our decisions, that we had to go back to what principles we wanted to adhere to.
And just, Nikki, the retention of that information by the business would need to be for at least 14 days.
Yes, so the reason why deputies and peers said 14 days is 14 days is the maximum incubation period of the virus. So retain it for 14 days and then it can be destroyed after. We also need to be able to get access to that data 24/7. So if it's 7:30, 8 o'clock on a Sunday evening, we need to have access to that data because we will start working on it that evening.
I think the other point in terms of the restricted licensing hours, again, I mean, that's primarily because of the influence of alcohol. I mean, the reality is that inevitably, the longer a premises is open and the more alcohol plays a part, then despite everybody's best intentions, social distancing will become harder. So I think certainly at this stage, I think it remains the intention that there should be a limitation on the time that licensed premises can stay open, but no doubt that will be kept under review.
Yeah.
Do you have
to say that the guidance is it's to 11:30 is the time. 10.
Yeah.
Excellent. And there was clearly law enforcement did have an influence on not opening up pub table service until Monday. And just so people fully understand, obviously last week it was announced about the gatherings and the parties being allowed, and we took a clear view that we have to keep the public safe, and that licensees as well clearly need to make plans for adapting their businesses. And our concern was that the capacity in licensed premises clearly is going to be reduced, and if everybody descended on, for example, town on Saturday night on top of the other areas that were being released, we felt that from a resource point of view, we would potentially struggle to cope with that. So I'm very grateful that the consideration was given just to that slight stagger, which now allows us the working week next week for restaurants and bars to move into that different phase. And of course, we would expect the following weekend to also be busy, and we're preparing for that. But it was about public safety, and it was about making sure there were sufficient resources from law enforcement to keep people safe.
To be fair to Rory, the advice from the police was police can not be any later than 11:30. We discussed this and thought, well, 10:30 to start with, but this is very much like before we went into lockdown, how we eased things down, and now we're just easing things back up again. So yeah, that won't last forever, but as we're going through this change process, we want to make sure that we can stagger it in and support law enforcement.
And it's also helping to reinforce the point that we've all got to learn to adapt, and that will take time. So everything is not going back to normal. Emphasising that, as I said in opening, that lockdown has not gone. You know, there are still restrictions.
Can I just ask a slightly on the same topic, how it will work for weddings? Say, you know, if 50 people are allowed at a wedding, but reception-wise, only 30 of those people are allowed. Is that correct?
Yes, and I think Nikki made it very clear the reasoning behind that. With a wedding, a more formal ceremony, people, you know, it's more easy to control by people going and what they're doing. Reception, bit of alcohol, people get more excited. It's much harder to maintain. And as Nikki said again, it's about 30 is ideal. And her team can still contact trace in confidence, and it's because it's of a less controlled environment and people are enjoying themselves. It's more likely that people might just get through past their social distancing bubbles. That it might be an issue. So that's why more formal weddings, funerals are 50, and why and the other social gathering is 30.
And a maximum table number in a restaurant, for example.
Well, it would be 30, but there aren't very many restaurants that would actually be able to fit 30-metre table, I think, and under those circumstances. But yeah.
Okay, next question. Yes, Will.
So if I can go back quickly about the travel and about the face masks. If you go to the airport and you refuse to wear a face mask, what happens?
Well, we would strongly encourage it, and we wouldn't refuse someone entry onto a plane. We don't have any legislation to do that. I would be extremely surprised if someone behaved in that way. It simply hasn't been the way that Guernsey or the bailiwick has worked in any way, shape or form. And we are cognizant of some people might not have a face mask. So the plan is when people go through the final security check and have their final check, they'll be given a face mask at that stage. They'll then be asked to wear it until they reach their final destination. Now, if you look at the functionality of face masks, they're effective for about 4 hours. After about 4 hours, they're of no good because they get moist and so on, and their efficacy goes down. And again, it's just that additional level of protection. What we don't want to do is people say, well, great, I've got a face mask, so I don't have to wash my hands. So it's just that additional thing, anticipating that our planes are going to be fuller and we'll be less able to distance people out spatially on the plane. So it might be that I've been too conservative, but I do like to try and anticipate something in the future, and which is why we've done it at this stage before we've actually been in a situation where the planes have been really crowded.
Can I just go back to
please.
The question that Ewan asked, because I said about 30-metre table. We don't need 30-metre table. It's so as long as people fit 30 people on a table and have distancing between other tables at the same time. So I don't want people to think you have to 30-metre long table.
Probably 40 metres a table with 2 at each end. That's pedantics.
Okay.
But you could, yeah, it's being able to maintain the social distancing in terms of the tables and the premises being able to cope with it.
So we're good.
Yeah, just in relation to the isolation, do you have any information or figures on how many Guernsey residents are currently stuck abroad and trying to get back due to border restrictions in other places?
I mean, it's a good question. We don't, I mean, there's no, we don't retain that kind of data because we just simply don't have a requirement to log it. We have been aware over the last few weeks of a number of residents seeking assistance, and of course our external relations team working with the Foreign and Commonwealth Office and their repatriation scheme. So as far as we're aware, most of those that have sought to get back either to the UK or to Guernsey have managed to do so, or have chosen to stay where they are for whatever reason. If there are residents who are still stuck overseas, and I've certainly been contacted by one or two who are sort of thinking about when they might want to come back, then obviously we would encourage them to get in touch and to think about the consequences, particularly, again, going back to the previous point about how they might need to manage a transit across the United Kingdom if there's a quarantine rule in the UK. So there's quite a bit to think about for anybody who is looking to be repatriated. Paul, did you want to have anything?
Well, I wasn't concerned about repatriation because I don't think we don't keep numbers on that, but we are conscious. We have to be mindful, and this is why the repeated message about that we're not out of lockdown and we must protect and use the same great guidelines that have been given us, because we will have increased numbers coming back to Guernsey. Students are a good example. Young forces personnel, where Guernsey is still their primary home, will be coming up for annual leave. So all the added procedures and checks and balances that we're doing, and it was earlier mentioned before, a specific tracking capability with the police for monitoring people that are in isolation have all been put in place. But I think this is why we're mindful that we might not have seen the complete elimination of COVID cases on Guernsey, and this is why it's so important to keep these procedures in place while celebrating the success we've had.
Okay, next question. We'll go to Aaron.
Aaron Carpenter, Bailiwick Express. For Dr. Brink, are the guidelines for hospital visits the same as those you outlined for care home visits? And also, are there any circumstances in which different family members, say a spouse on a Wednesday and a child on a Friday, would be able to visit an inpatient on different days, or has that been ruled out until a later phase?
So Dr. Raby and his team are refining and developing the guidelines for hospital visits, and they're going to make further announcements on those early next week. We're trying to balance the need to be safe with the need to also acknowledge that people want to see their relatives. So Dr. Raby's been working on that, and as I say, we'll hopefully get something, or we will be getting something early next week on that.
Okay. You and another one.
Yeah, just a question for you, Paul, about business support. Now we're moving to phase 4, and obviously more businesses will be going back into business and opening the doors for people to come in, what kind of support will there now be for those businesses? Because obviously they haven't taken any money, presumably, for the last couple of months. They've had some state support to get to this point, but perhaps they might need money now for stock, or to re-employ some staff again, that kind of thing.
Actually, I think it's probably more a question for me, because I think it's a political decision in terms of the decisions need to be made, policy decisions need to be made in terms of the extent to which different parts of the economy are supported. As Paul said in his statement, he's obviously recognised that particular parts of the economy will be more impacted for a continuing period, and the visitor economy is an obvious one, even if some hospitality is returning. So, as Paul indicated, we're keeping all of that, as ever with so much, keeping all of that under review, but no decisions have yet been taken. So there will be ongoing dialogue, and at some point some policy choices will need to be made. And again, we're seeing this elsewhere in other economies, and the extent to which continued business support is provided. And so those judgments are not particularly easy ones, but they've not yet been made.
Is it something you'll have to keep looking at, probably coming up to Christmas time again, and seeing where the economy is?
God, my goodness, Christmas seems like an awful long way off. I was thinking up to about the end of June before, but no, I mean, it's a serious question. The answer is I just don't know. I mean, there's so much that could change in this story. We've talked before about the need to plan for second waves, and of course that's something very much which public health and indeed the whole health team are of course engaged in, and equally we will need to be thinking about that in economic terms as well. Yeah, it will.
I've got a follow-up actually on the business. Obviously it's a huge challenge at the moment for pubs, restaurants, that kind of thing. Social distancing reduces their footfall massively. Are you concerned that hotels could be lost permanently? And also this tracing, it's very, very important, obviously, as Dr. Brink's pointed out. But that's a huge administrative burden on companies and businesses. And even if they're solo traders or what have you, if they're controlled, uncontrolled, what have you, how are we going to take that forward?
Well, I think, yeah, I mean, you're right. The social distancing requirements will have an impact on the revenue which many of those businesses will be able to generate. They would simply not be able to have the same level of custom, and indeed there will be many people who will still choose, understandably, if that's their choice, to be spending more time at home rather than going out. So that obviously all has to feed through in terms of the impact on those businesses. Sorry, your second question again?
It was really how you're going to then support that. Do you expect businesses to be permanently lost because of the necessary social distancing measures? Yeah, well, yeah. I mean, whether they will be lost or not, I don't know. I mean, I think the priority for us all along in terms of the economy has been that if we can get the disease under control and the prevalence managed locally, then obviously we can reopen the economy quickly. And obviously, as we've said before, the achievement in that regard has obviously exceeded our own expectations. So, which again emphasises the need to continue to keep tight control on the borders and not have a reintroduction of the virus, not least because not only because of the public health threat, but also because of the economic impact. So, the best thing we can do for all of those businesses that are going to struggle is maintain a very good public health discipline so that we don't have to go backwards. And actually, if we can continue to move forward into phase 5 quickly, that again will be another very positive thing that will help them. And that, from an economic perspective, is our objective.
I mean, look, just talk about that. And people have said, "Oh, why don't you go to phase 5 immediately?" It's because we don't know what's out there, and we're trying to say, yeah, it looks really fantastic, and we think it is looking really good, but we just don't know what's out there. By opening up as much as we have under phase 4, we should be able to, find any cases that are out there now, which, I mean, this is opening up to quite a big extent. So we're doing that, but at the same time having the social distancing and pushing those public health messages. So anything that does bubble up, we can hit on it really quickly and sort it out. But if things look like they're going so well as they have been, and we might just see 1 or might see 2, that is great, and we will be able to lift and move into phase 5 as soon as possible. But it's just being able to see that trend, and Nikki's saying, yeah, and thumbs up, we can go to phase 5.
I do think, though, that the question's a good one, and I think the panel and its immediate attention are very much on the response to COVID-19. But I don't think we should dismiss the referral I made in my statement as well, that government is working, and two of the members are at this table, very much form part of the COVID Recovery Advisory Group, working to create a recovery plan for the bailiwick, for Guernsey, which is very much concentrated on, for example, the economic impact. So what is the likelihood of the long-term impact? We talk about unemployment, we talk about the actual fiscal impact to the island, and those are all the considerations in the planning. And again, that'll be put forward for debate in mid-June, so you'll see the detail of that. But certainly nobody's treading water, and people are working on those elements as we speak.
And do you think, sorry, the one thing that perhaps we can look forward to is a build better message, build back better message? Is work going on in that front as well?
Well, certainly. I mean, I think that's very much the ambition, as we've said again at these events many times in the last few weeks. We shouldn't let the strategic opportunities pass, and across whether it's the reform of the public service in terms of learning to do things differently, or whether it's in economic terms. And so, yes, there is absolute determination to find ways to do things differently. Keelan.
Thank you.
Yeah, just on hotels and staycations, is there any guidance on the maximum number of people that hotels should be allowing to stay in one night, and then sort of how they manage people sitting around a swimming pool, for example?
No, I think really this goes back to the whole principles, and I'll hand over to Nicky, who'll be able to say it far more eloquently than me, but it's not about absolute numbers anymore, it's about that being able to maintain social distancing.
Yeah, so it was again to turn back and look at what are our public health principles, and going back to the question about restaurants and the distance and the social distancing. The reason why we did a 1 and a 2 metre was specifically listening to what businesses were saying to ourselves. So it would be very easy to say, let's just go for a 2 metre. But actually, for people to open their businesses and all that, it was very impractical. Now, we then went back and said, what can we do safely from a public health perspective? And I think that's really important. Going back to your question, again, you would be looking at the distance between people at the swimming pool. So no, we wouldn't want everyone sitting cheek by jowl in the swimming pool. We'd want to have a distance. So a swimming pool environment would be an uncontrolled environment because you wouldn't know who was where. So you'd want 2 metres between each group there. But in the hotel restaurant, where you knew who was sitting on each table, 1 metre is quite acceptable. So what we're asking, and I really do trust the community. I think the community has responded extraordinarily well to actually look at the guidance and apply it in a sensible and proportionate way. So that's why we've done the 1 metre and 2 metres. It was a much more of a headache for us because we had to really think what we were putting in the 2 groups. But we think it's practical and will open the bailiwick up in as safe a way as we can. But we also want to focus on the transmission, so the very health protection issue of transmission of a novel virus in our community. And that's really important. We've done really well. But now what we want to also do is focus on the wider health and well-being of our community. And we've worked really hard to get where we are. And we want to now take a step back and look at the wider well-being. And this is all part of that.
Okay, Ewan.
I just wanted to ask you quickly about what the updated advice is for people who are shielding or those over 65. Yeah.
So with shielding and people over 65, particularly those over 70, there's no doubt about it. If you get COVID-19 and you're in one of those groups, you are more susceptible to severe disease and the complications associated with COVID-19. So that's an absolute given, that's undisputed. I think as we move into a situation where we're 29 days with no new cases, I think there comes a degree of decision-making for the individual. So some people are shielding and really have very profound medical problems, and any exposure to, in fact, any infection, not only the virus that causes COVID-19, may impact on them. So what we would say to people who are over 70 or over 65 and who are shielding, we would say, think about what you want to do. And for those who are particularly in the shielding group who are more vulnerable, we would say to them, if you've got any doubts, is have a chat with your GP about it and decide what's sensible for you. So some people don't want to spend the next however many months isolated and by themselves, and that may be really impacting on their overall well-being. So we're trying to take that holistic approach. So the overall public health message is that if you're in those groups, yes, you're more susceptible to complications and more severe disease. However, we're in a situation with no new cases for 29 days. So think about what risks or not that you want to take, and perhaps discuss it with your GP, and then make a decision that's right for you. And I really think that personal responsibility and personal decision making, allowing people to make a decision that's right for them, is important, and I think we should allow the community the freedom to do that.
Okay, yeah, Kieran.
The Phase 4 guidance mentions extracurricular activities not permitted at this stage, where the mixing of children from various schools or year groups could take place. So does this mean that school children at the moment, they can't do things such as like sport outside of school where they might interact with others?
Yeah. Again, do you mind?
No, not sure. So extracurricular activities is something that we spent a lot of time thinking about. So if you think of what's happening in this phase, is we've got schools going back, we've got a lot of activity across the island. So with extracurricular activities, one of the main concerns is if you mix across year groups and across different schools, and you're just again putting another element of risk into the equation. So it was a case of how much can we do and how quickly can we do it? Now, in 2 weeks, 3 weeks' time, if we're doing really well, we might have a relook at that decision. We've always said it was a framework and we wouldn't make this tablets of stone, and that we would respond accordingly. And I tend to think in 2-week jumps at the moment. And the reason why I just think in 2-week jumps is that that's the maximum incubation time of the virus. So we'll go there, we'll see if anything bubbles up, and then so we move along like that. So it was really based on first principles again, saying how much risk do we want to put into the equation precisely at this point in time. If all things continue going as they are, we'll probably progress fairly rapidly onto phase 5, but we need to just go into phase 4, take a hard look, make sure nothing bubbles up that we need to deal with before we then move on further. So I realise that's not going to make everyone happy, but we've tried. So
can I just add to that? I mean, we have spent hours and hours on both the exit framework and the guidance over this week. I can't even remember how many variations we were seeing yesterday. We might not have got it all right in one go. It's not going to be perfect. We've had some things have been difficult to decide. You know, we were just talking about should we have closing time at 10:30 or 11:30. Extracurricular activities was another thing as well. We did speak about no extracurricular activities at all at one point. We're now saying, well, it's so long as it's not mixing between schools. And Nikki's really explained that reasoning. But it doesn't mean that we can't tweak things as we go along. And we're quite happy to. And we're listening to people. And we've said that all along. If we haven't got it right, we will change things. And listen to say, well, you know, it might be something somewhere that said, well, they can do this, but we can't do that. There might be a good reason why not, but we might have got it wrong, and we will look at and revisit that. So I think people don't need to worry that, you know, this is tablet set in stone, as Nikki says. It's we are been trying to do our best. It's been a lot of work. There's massive amounts of support. I should actually like to thank the people behind the scenes for this. They've done an absolute sterling job. The comms team, especially, getting like the slides out here and just getting things in a place where people can understand it far better than all our scribbles.
Great. Well, thank you very much. I think we've covered a lot of ground today, so it just leaves me just for some final messages. I'm going to repeat some things we've already said, of course, which is, as Heidi said, if you have any symptoms at all, of course, please do stay at home. That remains a very important message. Right back to the beginning, those key public health messages of washing hands. Really important we all get back into the habit as we start to spend more time out of our own homes. That is critical. The catch it, kill it, bin it, respiratory discipline and etiquette, and the distancing that, of course, we've spent a lot of time talking about. And, of course, again, actually, if you can work from home, and if that's acceptable to you and your employer, then again you should continue to do so during phase 4 if there's no requirement for you to be somewhere else. The final thing from me is just to report progress on the very generous response of the community to the 2 appeals. The COVID-19 response appeal has risen to 237,000 and the Social Investment Fund to 341,000. So thank you so much to everybody who has donated to either or both of those appeals. It is very gratefully received and will be well used. So with that, I will close for this week, and we will see you at the same time next week. Thank you very much indeed. Thank you.